Hi there, I'm Andrea Brognano, and I'm a licensed mental health clinician specializing in anxiety. And today, we're going to talk about panic disorder. Here's what we're going to go over. We're going to define panic disorder, recognize a panic attack, review panic attack symptoms, symptoms of panic attack disorder and their causes, getting diagnosed with panic attack disorder, and how to treat panic attack disorder. First, what is panic disorder? Panic disorder is described as a fear of a fear because people with the condition develop a fear and anxiety of future panic attacks and avoid certain situations they believe may trigger the anxiety and a panic attack. While avoidance works to decrease anxiety in the moment, it reinforces that false alarms, increasing anxiety in the long run. Over time, this reinforcement increases anxiety and avoidance to the point where it begins to interfere with a person's normal routine and their functioning, signaling the development of panic disorder. So what's a panic attack? A panic attack is a short but intense symptom of anxiety that develops quickly, often with little to no warning. People experiencing panic attacks often feel like they can't breathe or mistake the panic attack for a fear of a heart attack or other medical emergency because of how intense or life-threatening their anxiety symptoms feel at that moment. Although it's incredibly unlikely that someone would die from a panic attack. During a panic attack, a person will experience several of the following symptoms: heart palpitation or racing heart, shortness of breath, sweating, feeling choked, tightness or pain in the chest, nausea, upset stomach, shaking or trembling, dizziness, unsteadiness, feeling disconnected from themselves, feeling disconnected from their surroundings, fear of dying from such intense symptoms, numbness or tingling, or feeling hot or cold. The symptoms of a panic attack are mainly physiological in nature and tend to be experienced more intensely and for a much more shorter period of time than any other kinds of panic attack anxiety. Panic attacks can happen either at night or during the day, and many are caused by a certain trigger. Panic symptoms are typically not dangerous, but they are very upsetting, scary, and uncomfortable. Research shows that people with panic disorder more frequently use medical and emergency services. So if I've had a panic attack, do I then have panic disorder? One of the main reasons that panic disorder is misunderstood is because there is a common misconception that anyone who has had a panic attack then has panic disorder. In reality, panic attacks can be a symptom of any mental health disorder. Panic attacks are more commonly reported by people with disorders where anxiety is predominant symptom, including post-traumatic stress disorder, obsessive compulsive disorder, generalized anxiety disorder, social anxiety disorder, or agoraphobia, and other specific phobias, such as fear of thunderstorms. People with one of these conditions may experience panic attacks in response to specific triggers associated with their disorder. For instance, people with PTSD might have panic attacks during flashbacks, and people with social anxiety could have panic attacks in large groups of people. People who experience panic attacks as a symptom of another disorder sometimes go on to develop panic disorder symptoms. The most obvious symptom of panic disorder is the experience of repeated panic attacks. People who develop panic disorder have a conditioned fear of future panic attacks that become a primary source of anxiety and lead to avoidant behavior that disrupts their normal routine. Some symptoms of panic disorder typically include the experience of recurrent unexpected panic attacks, or at least one of these attacks has been followed by a month or more of at least one of the following: persistent concern about additional attacks or the consequences of another attack, like fearing losing control or going crazy, and significant maladaptive changes in behavior or routine related to attacks, like avoiding a place or an activity. The attacks or resulting symptoms are not related to the use or effects of a substance or medication and are not result of underlying medical issue. And lastly, symptoms of panic disorder. The disturbance is not better explained by another medical disorder, like a phobia or other anxiety disorder, PTSD or OCD. So what causes panic disorder? There isn't just one cause that explains why people develop panic disorder, although certain factors make it more likely to occur. When a person doesn't understand that their symptoms are anxiety related, they are more likely to interpret them as dangerous or even life-threatening. These interpretations can create a cycle of anxiety and avoidance characteristics of panic disorder. The confusion and fear about the physical symptoms of anxiety is a central driving force in the development of panic disorder. So how is panic disorder diagnosed? Panic disorder can only be diagnosed by a licensed health or mental health professional. These professionals have the training and the experience to be able to differentiate between panic disorder from other disorders with similar symptoms. Even in cases when panic disorder is diagnosed, there's often underlying disorders. Criteria for diagnosing panic disorder. When a mental health professional is determining if a person has panic disorder, they look for panic attacks that are recurrent and unexpected, worry about the next panic attack, emergence of negative coping skills like substance use or skipping work to avoid or delay future attacks. To have a panic disorder diagnosis, the professional must also be sure that the symptoms are not caused by another condition or from the use of medication or substance. Most people might not know that there's a self-assessment tool for panic disorder. Panic disorder, like all other mental health conditions, can only be diagnosed by a licensed health or mental health professional. Knowing the symptoms, however, can help a person determine whether they need to set up an appointment with a professional who can provide a formal assessment. Symptoms can be identified by using the Anxiety and Depression Association of America, ADAA, screening tool for panic disorder. We will link this screening in the description for you. Luckily, panic disorder is highly treatable. With therapy, medication, or a combination of the both, many people with panic disorder are able to reduce their symptoms or even make a full recovery. Recovery might mean that they still experience panic attacks, but they learn better methods of coping and can keep them from interfering with their daily lives. Panic disorder is debilitating for many people, keeping them from being able to function and follow their normal routine. People suffering from panic disorder often feel hopeless about their symptoms, but research shows that therapy, sometimes in addition to medication, is highly effective to treat panic disorder. With treatment, people with panic disorder are usually able to reduce greatly or even resolve their symptoms, which greatly improves their quality of life.